The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. Welcome to the Choose Effective Policies and Programs in-depth webinar, which is part of the County Health Rankings and Roadmaps Take Action series of webinars. My name is Kate Konkle, and I am a community coach with the County Health Roadmaps Project. My colleague Karen Odegaard is also here, and you'll hear from her in just a few minutes. Jan O'Neill, another community coach, is also joining us this afternoon, and she is going to help with some questions. We are pleased to be joined by Sarah Kile, health educator and grant writer for the Central Michigan Health Department. The County Health Rankings and Roadmaps program is the result of the contributions of many partners, including the Robert Wood Johnson Foundation, our colleagues here at the University of Wisconsin Population Health Institute, and the various partners who help us compile the rankings data and get the message out about rankings and roadmaps. We want to take a moment to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window, on which you'll see my screen throughout the presentation. On the right, you can see the control panel, which is where you can interact with us. We will be taking questions via the control panel. Feel free to enter your questions in the control panel at any time, and we will answer them towards the end of the webinar. Throughout the webinar, we will also chat out relevant links so that you can watch for those in the control panel as well. Here's a quick outline for today's webinar. We're starting with a quick check-in, and then we'll talk with Sarah about a tool her coalition used to select a policy to work on in Central Michigan. And then finally, at the end, we'll take some time for your questions. Again, if at any time you have a question or comment, please write them to us in the question box. When you registered for this webinar, we asked you to let us know what's going well with and what's challenging about choosing effective policies and programs. We're going to put up two polls with some of the key themes we heard from some of you. And we want to hear about which of these resonate with you. So first, the successes. And you can select more than one. Your options are policy work is becoming more accepted in our community, a success of engaging key stakeholders in the work, success about implementing policies and or programs, or other great things that are happening. So we'll launch, this poll is launched, and go ahead and let us know. Again, you can choose more than one. What's going well in your community around this particular stage of the action cycle?
And we'll just give you a few more moments. Okay. And we will close the poll now.
All right. So it looks like a lot of you are having success in engaging key stakeholders in the work, which is great. I know that can also be a challenge, so it's good to hear that a lot of you are having some success in that area, and that policy work is becoming more accepted in our community. I know last week we talked about sometimes that transition from policy or from programs to policies can be a little uncomfortable for people. So I think it's good when we start to see that tide turn. And then actually implementing the policies or programs. Also, lots of good stuff going on there, it looks like. And hopefully, you can always let us know in that question, in the question box or the comments, what some of those other great things are if you'd like to share them with us.
We'd love to hear about your successes.
Okay, so now we're also going to hear about some challenges. And you, again, can select more than one. And the challenges that we heard from in the registration were choosing to work on policy rather than just programs, engaging the right people in choosing policies and programs, choosing a policy or program that fits the community, choosing a policy that is politically feasible, and other hard things. So some things that maybe are going on in your community that we didn't mention here that you find challenging. Again, you'll see that some of the challenges and successes often overlap, that even when we're having some success, it may still continue to be a challenge, or other communities may not be having that same success quite yet.
And we'll just give it a few minutes or a few moments more. Okay. And we'll close the poll.
All right, so again, engaging the right people in choosing policies is up there, along with choosing a policy that is politically feasible. And hopefully the tool that we look at today will help you really figure out what policy is going to be the most politically feasible for your community. And again, that choosing a policy or program that fits your community will hopefully help you figure that out today as well. And again, for those of you still struggling to choose policy rather than just programs, we had that discussion some last week. And it's not an easy thing to do necessarily, but if you keep pushing and you keep going in that direction, it's definitely a doable thing. All right. So for those of you who have joined some of our other webinars, in many of our webinars we provide a brief overview of county health rankings and roadmaps. Because this webinar is really focused on a particular tool in our Choose Effective Policy and Programs Guide, and we really want to have time to jump in and really look at that tool closely, we are going to chat out some links to you if you're interested in learning more about rankings and roadmaps. There's a lot of great information on some of our past webinars, and we would invite you and encourage you to join one of those to learn more about the overview of county health rankings and roadmaps. But for now, I am going to turn things over to Karen and Sarah and jump into talking about our tool.
Great. Thank you, Kate. And we are excited to have Sarah Kile with us again. Sarah joined us last week to talk about that shift from programs to thinking about policy. And now we're going to learn from Sarah a little bit about how they selected which policies they wanted to work on in her community. So Sarah Kile is a 12-year veteran of public health education, working to promote abstinence, reduce substance abuse, and now working in health advocacy. She has been recognized locally and has received a legislative tribute for her work to improve health and quality of life for those in the communities she serves. Sarah leads a 2-county health improvement planning group affectionately called HIP. HIP has been recognized for work in policy, including recently being awarded a Michigan Health Policy Champion Award. Sarah is going to talk with us today about how her community used the Policy Advocacy Choice tool to decide on a policy to address substance abuse in Clare and Gladwin counties. So welcome, Sarah, and thank you so much for joining us and for sharing your experience with this tool.
I'm always thrilled to be here. Thank you.
The Policy Advocacy Choice tool is a decision matrix to help groups select the policy or systems change that will have the greatest likelihood of successful adoption in their communities. There are 2 pieces to the tool, the Policy Advocacy Choice tool and the Policy Advocacy Choice worksheet. We emailed both of these links to both of these pieces about an hour ago, and we're also going to chat out the links to those tools now. So working through the tool helps groups identify who will support and who will oppose each option, providing information that will also help in planning a successful communications campaign. The tool helps groups consider multiple criteria when selecting a policy or systems change, including community values, doing a community values analysis, a health impact analysis, and a stakeholder analysis. The stakeholder analysis looks at public acceptability or public support, political support, and implementation ease. So we're going to talk about each of these different criteria and analyses that the tool walks us through, and hear how Sarah's group considered each criteria in selecting a substance abuse policy to work on. So first, some considerations for using the tool. when thinking about whether this tool is right for your community to use now, think about whether your group is really ready to start focusing on a policy change effort. Do you have a diversely representative group? Do you have people from all walks of life in your community, or at least from areas or sectors that would be impacted by the policies you're going to be considering? And is your group engaged? Are they ready to move forward? Do they want to be working in this direction on policy change? And then you also want to think about who should participate in this process. Thinking about who is going to be impacted by the policies you're considering, and are those populations involved in the discussion? What do they care about? It's just, how are you including their voice in the work that you're going to be considering going forward? And how long does the process take? This is always a challenging question, and it's the one that has the frustrating answer of it depends. But it really does depend on things like your community's level of readiness, your decision makers' readiness for policy change. Do you have the right people at the table? Do you need to start building trust within the group who's going to be working on policy change, or do you have a good foundation there of people working together? So there are a lot of variations in terms of what needs to be in place, or not what needs to be, what is in place, and how long that's going to take to select your policies that you might include in the tool, and then figure out which policy makes most sense in your community. So there are 3 things to do before you begin using the tool. First, you want to define your targeted focus of change. So for example, if you're thinking about an institution, are you thinking about a specific school? Are you thinking about a new housing development? What specifically are you thinking about? Maybe it's a geographic area. Maybe you're thinking about being focused on a specific population. So you want to define that area, because being clear about where you're focusing the change will help you select the options, policy options later on. Second, you want to be sure that you've identified a goal statement for change. For example, are you looking to improve access to healthy foods, or increase activity for older adults, reduce underage drinking? Having a specific goal in mind will help you evaluate policy options. Sarah, I believe that your policy, your overall goal was to reduce underage drinking. Is that kind of how you set up?
Yeah, both Clare and Gladwin counties, that's where we really wanted to focus, was underage drinking.
Okay, so you defined your change target as Clare and Gladwin counties, and set your goal statement as reducing underage drinking.
Yep.
The last piece that you need to have in place are your policy options. What policy or systems changes will you consider? So you want to put together a short list of specific policy or systems change options for addressing a health factor. And it's an important point here to be sure that you're really including only policy or systems change options and not programs, so you're able to compare apples to apples. What Works for Health is a great source that you can look. Pardon me. Is a great source that you can look to help you identify potential policies or systems changes. What Works for Health is a database available on the County Health Rankings and Roadmaps website. It provides communities with information to help select evidence-informed strategies that will improve the variety of health factors that we know affect health. So I'm going to include a link to that. I'm going to chat that out to you now. So if you're not familiar with What Works for Health, it's a great tool that can help you identify evidence-informed policies and programs. Sarah, can you talk a little bit about how your group decided on the policies to include in the Policy Advocacy Choice tool?
Absolutely. I do like that you reminded the group to focus on policies, because when we first went through this, we did focus on programs. We used it incorrectly because we were so program focused. So we started to focus on policy, and some of the pre-work with our group was sending them to What Works for Health, asking them to peruse the policies on their own, and come to the table with what things they really thought would be useful, what things they thought we could do, what they were passionate about, because there's quite a few options, what things they thought we could use. So really it was making sure they understood that we're, okay guys, this time we're going to really focus on policy and where this policy database was. And What Works for Health is a really kind of easy place to go where people can find those evidence-based strategies.
And Sarah, it's really helpful for us and fortunate for us that your group did go through this process twice. I think that you will offer a lot of helpful lessons of things that worked well and didn't work as well in using this tool, so folks can take it and start running with it. So thank you again for sharing your experience.
Well, you know, sometimes we do forget to focus on policies. When I took this position, it was a policy advocacy coordinator, and I'm going to need to focus on policy. But it was Jan, who was our community coach, who had to remind me, wait a minute, you did it, but you did it with programs. And it was an aha moment of, this is where my mindset needs to change. And now when we talk about policies in all of our advocacy areas, What Works for Health, I'm probably on there at least once a week. I'm emailing that out at least 2 or 3 times a week to our partners saying, here's the database. We don't need to, you know, it's just like the list of curriculum that we used to look at, you know, what curriculum do we want to buy? No, now we have a list of what works literally for health when it comes to policies.
Sarah, you have I love the way that you talk about policy versus program. And, you know, as we're kind of talking about that, can you share that with the group, how you think about what we mean when we're thinking about policy versus what we think about with programs?
Right. Well, programs, we had talked about this the last week. Programs are really focused on one classroom, you know, one group of people. And when we focus on programs, that shift in our mind has to be, you know, programs are today for this classroom, but a policy is about a generation. We're changing a lot more than kids that we'll never see or people that we will never have contact with. But a program really truly is only the people who are sitting in front of us. So that's really the mindset that you have to have is, you know, I love programs, love getting in there, getting my hands dirty, but I want to make an impact on my community for a generation. And that's where you have to, over and over when policy work is tough, when you start to slip back into programs, wait a minute, well, we want to buy this curriculum. Well, programs are great, but I want to impact a generation. I want, long after my funding is gone, long after I find a different position, whatever happens to me or to our HIP group or Together We Can, we want to make sure that for a generation we're changing the health of our community.
That's great. So having decided that you wanted to work on a generation of reducing underage drinking and trying to get to the policies that might impact that, that's how you ended up working on the Policy Advocacy Choice tool. So I'm putting up here, and this is the only screenshot we're going to do of the actual worksheet, but I want folks to get a sense of what it looks like. And we did, as I mentioned before, send out links to both the worksheet and the directions in the tool. But once you've done that pre-work, you're ready to move into going through the different analyses within the worksheet. And the worksheet will actually calculate your scores as you go and help guide you to the policy or systems change that may have the greatest likelihood of success in your community. The worksheet also includes an example that has been filled in for school nutrition. And on our website, we will also post the worksheet that Sarah's group actually filled out. So you'll be able to look at her specific example. It'll be posted on our website, and we'll share that link a little later. So this is where we're going to be headed, going into this Policy Advocacy Choice tool and looking specifically at the worksheet and working our way through the different analyses. And we start with community values. So the tool asks groups to rank 4 values according to which they think is most important to their community. And when we think about what are we talking about with values, a way to distinguish this is beliefs are an expression of what we believe to be true, but values are what we do as a result of what we believe. So, for example, if a community believes in equity, but that belief doesn't actually translate to a willingness to pay for public schools or to ensure access to sidewalks and fresh foods in all neighborhoods, then it may not actually be a value for that community. So that's the distinction between beliefs and values. And what we want to focus in on here are what are the values for our communities? Where are we actually willing to do the work to actually implement things, and what values do those policies and programs really fit under. So there are a lot of values that might be important to your community. The Policy Advocacy Choice tool directs us to think about 4 specific values, and we're going to walk through those 4 specific values now. So the first is equity or fairness. And this is, you can think about this as how fairly resources are distributed. So this is the degree to which our community has taken action to ensure everyone has equal access to community resources and opportunities, and that no individuals or groups of people should be asked to carry a greater burden than the rest of the community. So this is the first value that we can consider. The next is efficiency, or thinking of this as cost versus benefits. This is the degree to which our community cares about what things cost and how much heavy lifting is required by implementation. Efficiency refers to both financial, or money, and administrative, things like time and ease of delivery, resources. So we're thinking not just dollars and cents, but also the time and the resources that it takes and being efficient with those things. The third option is liberty, or freedom of choice. You can think of this as the individual rights to choose. And this is the degree to which our community supports each individual having the right to choose what they want versus being required to follow certain rules or regulations for the good of the whole. The fourth value is security, or the future. Thinking of this as ensuring health today and tomorrow. This is the degree to which our community has taken action to ensure that the future generation's health and well-being. So we'd like you to think for a moment about what you value most. And we're going to actually put up a poll that you can answer this question for yourself. What is it that you value most? Equity, efficiency, liberty or freedom of choice, or security in the future? We're just going to give you a moment to fill this in. Sarah and I have been talking in preparation for this about how this is a deep discussion to get into when you start this work, but it is an important discussion to have with your group. And Sarah's going to talk a little bit more about that in a moment. So it's easy to feel intimidated, I think, by talking about values for your whole community, but it's understanding where your community is at with values and what is important to your community that can help you be successful with implementing or adopting and implementing policy changes. All right, so I'm going to close the poll. Thank you for participating. And we can see that a lot of folks are in this security future value and then followed by equity and fairness. Sarah, you all ended up in the security and future value. Is that right?
Yes, ma'am. I was definitely in both times that we did this, the incorrect and the correct way. It came out first.
Okay, great. So next, we want you to think about, you've done this for yourself. This is what you value. But now think about policymakers in your community, or maybe think about a particular policymaker in your community. And what does he or she, what do you think that he or she values most? We're going to launch this poll again, but thinking about it again from a different perspective, from the perspective of a policymaker in your community. And we'll just give you a few moments here. Okay. And oh, you're just clicking right away, so I'm going to let you keep clicking for just a moment more. And we will close the poll. All right. So you can see here that a lot of people, and I don't know who voted for what in the first one, but a lot of you really believe that efficiency is most important to your policymakers. And the reason that we did these two polls is that it's important to include a variety of perspectives when you're thinking about and trying to decide what is it that your community values most. In order to really understand what your community values most, you need to have the different perspectives at the table to talk about the different viewpoints of the four values that you're going to be considering here. Sarah, can you talk a little bit about how you arrived at the future and security as your value?
We did. There was a couple of things. We had some good discussion. We had to agree on some understanding because, liberty, freedom of choice, security, these are very abstract terms, and we needed some concrete definitions so that we knew that we were all working together on we had the same understanding. We were also right after, close to an election time, so we could look at recent, millages and see kind of where people voted yes or voted no. We also had some politicians in the room who look at policy quite often and look at what is their community value. We had our local prosecutor and our sheriff. So it was an interesting discussion, and I like how you said that because this, when you said, this tool can take as much or as little time as you can give it. This piece, it really built some trust in our group because we had to kind of set aside some of our previous understandings and really truly agree on, okay, what do we mean when we say liberty, guys? Let's make sure that we're very clear. And they did a great job because if you use this tool, it offers you these definitions. And we had to agree on them as a group to say, you know what, we're not going to go past this definition that we're all agreeing on. And we did. We just talked about it and said, where in our community, what's most important right now? And cost was number two. We don't have a lot of money in Clare and Gladden counties, but we did see from local. Everyone there agreed that the community value first was what's going to happen, what's coming up, we're always focusing on what's next, what industry can we bring in the area. It didn't matter what seat we were sitting in. We're really trying to focus on the future, but we also had to focus on money. So we had security and future number one, and then cost is number two.
And I think this is where, this is a really important piece of thinking about in the beginning when we talk about how long does this process take. That idea that if you don't have those diverse perspectives already at the table, the importance of taking the time to build those relationships and get them to the table. Because you really, as we saw in this very brief exercise, just thinking about two different perspectives, it's really important to take the time to make sure that you have a diverse representation that really can have that rich discussion of where are we as a community, because all of these values exist within every community. It's really what one rises to the top for us at this particular point in time. And things may change in communities over time based on different things that happen. So really important to make sure you have people at the table and spend time doing that part of the work. If you don't feel like you have a lot of public health people sitting around the table, or a lot of the people that work in schools, they're going to have one perspective, but having the sheriff and having law enforcement and judges and politicians and other community members really broadens that perspective.
Yeah, I think if we would have just had like some of our commissioners and, again, some of those people who really their job is to make sure the budget balances, things would have been a little different. But, we did have a really great perspective of everyone, I think. And if we would have had some, we had some people who are very focused on the, freedom of choice, and policy work scares them because of that. So that might have been a little bit higher if we were if we were heavy on that side. So it is about saying, do we have representation of everyone? And if not, am I willing to go out and ask the questions? Sit in our lobby, whatever that may have been. I do believe we had good representation, but if we didn't, you really have to think about what am I willing to do to make sure that we have that representation.
This is Jan. I'm going to just jump in here too, just to build on what you all are saying. Is that, Sarah, I also remember us talking about, as you have those diverse people in the room, one of the questions that could be asked as well is, and where do we see those values being played out in our community? What policies are already in place? What laws, what regulations, what are the voting, what kinds of things do our citizens vote for that would show us, yes, equity and fairness is the most important, or in your case, you said securing the future, that there would be a behavior, an action, a vote, a law, a regulation, even investment of volunteer time that would show, yes, this truly is in action in our community. Because we can talk about what's important to us, but it's when we look out into the data of what's really happening in the community that we see what's, at least what's current truth.
And you know, Jen, I would agree, especially looking at, look at your last few ballots. I can speak for my communities, but I'm sure it's similar in others. Millages are a really good way to see what people think is important. I mean, what are they willing to put their money into? Are they willing to put it into, into security? Did the 911 or the safety one pass? Or did they not pass even one? Are they just not willing to spend another dime? Where are they putting their money? Because, there can be a lot of millages on our ballots. And even looking at ballot languages. Going to your local city and saying, hey, what was in the ballot for the last 2 elections? They're more than willing to help you out with that, and most of it you can find online.
That's a great point, and another idea for how to get to that information and start to assess that a little bit. The other thing I want to just take a minute to note, Sarah had mentioned the importance of understanding the definitions of each of these values, and we talked through them a little bit here, but you will find those definitions written out with some examples on the tools. So, you don't have to commit them from memory from what we just discussed here. And it is something that you have to kind of revisit and think about and build that understanding among your whole group who's going to be looking at this tool. So once you've identified which value is most important and kind of ranked those values, you start to look at the policies that you've selected and how will those policies impact that value. Is it going to support that value, or is it going to kind of work against those values, and start to analyze how they interact, how the policy options that you're looking at interact with the values. The next piece of the tool is to look at the health impact. So the tool asks you to rate the health impact of each option. And to complete this, what you're going to want to look at are literature and any data sources that can help you understand what impact the policy option is going to have on health. And you can use your specific goal statement to measure these options. How well does each option address your goal? What works for health? We mentioned it before, but it is also particularly useful here because it can help you understand the evidence of its impact of policy impact on a health factor. Sarah, can you talk a little bit about how you gathered information for your health impact analysis?
We actually use just what works for health. There are other places to go, obviously, some of the other databases of resources, but what works for health gave us, like whether it was scientifically supported, suggested, not supported at all. So it kind of gave us a really, I don't want to say easy out, but it helped us answer those questions. There was some digging because one of them was just suggested, so we had to look, has it been used in our area, things like that. But what works for health really gave us that tool right away.
And I just chatted out a link again to what works for health. So if it's something that you haven't looked at, I would encourage you to spend a little time playing with what works for health as well.
You'll find so much on there. Again, I hate to always push that, but I email that out 3 times a week now to people who are saying, I don't know what we're going to do next. How do we decide? It's right there. It's right in front of you. And it even takes you to the links where the research is. And it's a great tool. And again, I sent that to the group when we used it the second time to prepare for the actual policies that we were choosing for the programs. I sent it to them, and they had already done the research before we got there. They had looked into it, found out what they can do.
That's great, Sarah. So it was an easy way for you to engage the work group in selecting those policy options. It wasn't just something that you sat down in your office and put together.
Right. In fact, some of ours, they were a little off from our stated goal, but I had to take what they wanted and say, okay, let's go through it. You think that this is going to impact underage drinking? That's probably a bigger picture of drinking, alcohol, excuse me, but these are the suggestions they brought to the table, and let's put them in here and see what comes out. It's not going to hurt. This is a tool. We're not putting anything, chiseling it in concrete. This is going to give us some really great ideas.
Great. So once you've looked at your health impact analysis, you move on to a stakeholder analysis. So this can help you understand who might support or who might oppose each option that you're looking at. So to complete this part of the process, you're first going to brainstorm all stakeholders, including the public. So this might include citizens or taxpayers, advocacy groups, nonprofit agencies, businesses, anyone who has a vested interest in the policy options that you're looking at and the goal that you're trying to address. You also want to think about specific political stakeholders, and this might include elected and appointed officials, lobbying groups, all of those who have power to give you what you want. And you'll also want to consider implementers. So this might include administrators, staff employees, basically those who will be charged with actually adopting the policy or systems change and making it work. So you take a look at all of these different stakeholder groups, and you brainstorm who the stakeholders are in each of these groups. And then within each option, within each policy option that you're considering, you identify who the decision maker is. And that might differ by option that you're looking at. The tool then can automatically weight the decision maker scores heavier than the other scores. So it then walks you through what might these stakeholders think about the policy options that you're looking at. Would they be in favor? Would they be opposed? How would they respond to the policy options that you're looking at? So Sarah, talk to us a little bit about this part of the analysis.
Well, this is again a great discussion. I think each piece of this really could have been a meeting on its own, because you have to determine who those stakeholders are. And this is learning for me as well, and we had a coach, thankfully, to help me understand this before I used it. But deciding what does, in the public, who are groups in the public who are stakeholders. We had to really separate them out, to get as specific as we could without, specifically naming names. Like, there's a difference between parents who do buy alcohol for kids and parents who don't buy alcohol for kids. And we had to look at those groups. We had to look at, very specifically brainstorming for each of these areas. And this could have been, I think, even a longer piece for us, because it really would, and I don't think it would ever hurt to, again, take even one whole meeting to do each of these pieces, because you could brainstorm for quite a while and really boil down who do we need to focus on, who's going to have an impact with this decision if it's made, or with this policy. So I thought it was definitely interesting. When you get to the political support, and I had mentioned this previously, it was really fascinating, the two different groups I worked with. One group was a much larger group, and the second group, they had, this piece was a bit more difficult, because we're trying to think of specific people. We don't have a million representatives or commissioners, state senators, and trying to figure out how do we decide what they would think, and talking about their their voting history, things like that. Where do they stand on these issues? I thought that was such a great conversation, again, to have. I think ultimately this tool helped us pick policy to work on, but it also opened up discussion of what things we need to start thinking about, start working on between now and then. Even if we haven't picked a policy yet, we need to start talking to our local legislature about what we're doing, about what their thoughts are, talk to our local judges, our local police departments, things like that.
Sarah, that's such a great point, and I think that the stakeholder analysis is really something that it's useful, obviously, for this part of this tool, but it's also really useful for thinking about what your next steps are going to be in terms of, okay, now we need to put together a communications campaign. Who else do we maybe want to add or engage in our coalition's work? Do we need to bring other people on board to get them involved in our work? So it can help you, I think, not just judge which policy might make the most sense, but also start thinking about how are we going to move this forward, and how can these stakeholders, what role can they play in the work that we're going to be doing as we start to implement or work to have a policy or systems change adopted.
I definitely think if you're going to use this, if you want to use it quickly, hey, get through one meeting and try to get this tool done, God bless you, that would be awesome. But make sure that you have like a parking lot, because you're going to have those questions and you're going to have those things come up. I mean, if you have a trust and open conversation in your group, those things are going to naturally come up. And you need a place to say, you know what, that's a great idea. We can't lose that, even though we're trying to get through this tool. And it may be a to-do list of, hey, I have no idea what our local whatever judge thinks about this issue, and I think he might be a stakeholder. I think he might be, so someone needs to look into that. Let's not, if we want to get through the tool, maybe we don't need to focus on that right now, but having a parking lot or a list, because this is a very rich conversation. And if you miss those pieces, you could be missing, crazy important stuff that your coalition, that your group really could use, like you said, in the future, deciding what's next, who I need to go to, using other tools, to decide where do we need to go.
Great. Thank you. So once you've put these different analyses together with using your worksheet, the worksheet will score, will give you a score that can help you understand which policy might be most successful. You'll also be summarizing your overall findings. You'll summarize in each section, but then you'll summarize your overall findings at the end. And it's important to, once you get to that result, to take a moment, pause, and be sure that you talk about, is the option that was selected, does it pass the gut check? Does that really make sense for your community? And if it just doesn't feel like it's the right thing, you may not want to take a step back and revisit some pieces of the tool again. And I wanted to jump in.
Well, I was just going to say one thing about the options also, because you can see this on the worksheet. The first option is actually status quo. And that's an important option to consider, because policy, systems, environmental change, that's hard work. So that's why we want to put the time into really thinking it through carefully at the front end. And status quo, the way things are right now, it has to be worth it to us, that we're willing to invest the time and the effort to make that change. And it may, at the end of the day, you might find out, you know what, we just don't have the support for this in our community when we look at all these different options, at least compared to status quo. Maybe we need to find some other policy options, or maybe we go back to status quo and tweak that, or move on to another area because we're just not ready yet. So that's why status quo is in there throughout the whole decision-making worksheet.
Yeah. Thanks for pointing that out, Jan. Sarah, what did your group find? Tell us a little bit about what your results look like, and were they surprising to you, or did they make sense?
It was, we thought the math was wrong. We went in there thinking that we knew because, hey, we've worked in this field, we understand substance abuse, we understand kids. We thought we knew what the final outcome would be, and when we got to the last page and saw the scores, it was kind of almost that gut check, but, well, I'm sure they screwed up on the math. So we had to go back, and when we really looked at our discussion, because in there you write the summary of your discussion of what you had, and when we really looked at it, we saw, wait a minute, we thought we knew what our community would work. We thought, hey, we're the experts, we know what's going on. But when we started to think outside of our own experiences, outside of our own expertise, and saying, what is it our community, what is it our stakeholders really want, we found that it was not even the top 2 options. It actually was down to number 3. Some of the top options were not things that we considered to be like sometimes we call like the low-hanging fruit, something we know we can do, we know that we'll go forward with. So that was really interesting to us. It was really interesting to me, and it made me really enjoy that process because, again, it humbles you to think. In program work, again, I know what I'm doing when I go and I'm teaching my curriculum and change the numbers and call it good, but we are not necessarily the experts when it comes to policy. Our community is. Our stakeholders are, and again, it changed how we saw what we decided on, for the policy that we're going to work on, because it didn't have to do with us in the group. It had to do with focusing on our stakeholders and the entire analysis. What does it mean to our community? So we found it really interesting because, again, I went back and I checked the math because I'm like, that can't be right. This is going to be our #1 option. We knew that going into it. We all liked it, but it really changed what we decided to focus on.
All right, that's great.
So I just wanted to point out at the bottom of the worksheet, there should be a link to the SMART chart. Mm-hmm. And the SMART chart comes from Spitfire Communications. They're out of Boston, I believe. Maybe I have that wrong. But it's a free online tool for planning your communications campaign once you've decided which policy, system, or environmental change you want to adopt in your community. And it's very user-friendly. Sarah, I think you started using that, right?
Yeah, absolutely. Anyone can get on. You don't have to, always use the coaches at the University of Wisconsin, but anyone can get on this tool and start using it because it really, truly is that user-friendly. It breaks it down very systematically. For someone who, I've never heard of SMART Chart before in my life, but to be able to get on there and use it, absolutely. And you can use this in all areas, including, different groups that you work on your own, volunteer groups. This is a really fascinating tool to be able to get on and say, I think I know it's phenomenal. Sorry, Jan. I'll stop talking.
Oh, no, that's great. I'm glad you spoke to it because, yeah, but it links so perfectly from this tool because once you've done the analysis of what's important to your community, you'll have a much stronger hold on what's the messaging we need to use, what's the language, what's our pitch got to be, who are the decision makers, who has the power to give us what we need and what we want, and then how can we message to them so that we can make this all happen. And it has how to write SMART objectives for your campaign, and it's very well thought out. So it's a good linking tool to this.
The next step.
It's a next step tool.
Yeah.
And it's right in the chart.
Yep. So we're going to take time now to answer some of your questions about this tool, about Sarah's work with the tool, and yeah. So feel free to enter your questions into the question and chat box. And we're going to start with a question about whether community values, whether the values that your community has actually is dependent on the length of time that you have for a goal. So, for example, if you have a long-term goal of health outcomes versus short-term goals of project costs, could that be? Does that speak to your? Does that impact the values that you're looking at?
And
yeah,
I'll take a stab at this one. So I think your community values are values that are generally stable. Again, they may change over time based on things that shift in the community, but they aren't going to be, or they shouldn't be, dependent on the length of your goal. I think what I would say to that is, if you want to work on a policy that is a long-term, you're not going to see an impact of it for a long time, and your community value, when you sit and talk about what those are, is efficiency, that may not be a good match for your community because they very much would probably rather see something where they're going to see a quick return on their investment. They want to know that the money they spent up front or that they're spending now, they want to be able to see that it had an impact probably pretty quickly, whereas if the community value, if you identify it as security and future, they may be more willing to think about a policy that may take a little bit longer to see the impacts of. So I don't think is your short-term or long-term goal is impacting the value. It's the value will speak to whether or not that's a good fit for your community.
And if you know about your community that they value efficiency, and yet you've picked a policy that's going to take a long time to adopt, and it's going to take a lot of sell, what you might build into your communication strategy is language and also measurable benefits along the way so that people can see much sooner what the impact is going to be. So you might break it down more through the process.
Or you may need to look for some policies or systems or environmental changes that are going to see more tangible results more quickly. like an orchard, for example, putting things in place at the in a schoolyard that people can see right away that there is an impact. They may not see that long-term health impact, but they see something that's more tangible, and that may help introduce them to the idea. But the community values aren't going to be dependent on the goal you're setting. That they're going to inform which goals you should be, how you're going to reach your goals.
And the way the worksheet is set up also is that the weighting of the options, the different policy options, they're doubled, for example, if it's the most important community value. So, but that doesn't mean that's the end of the game. That's just part of the conversation.
We also have a question about distinguishing the difference between a policy and a program. And I think people struggle with this. And I know it can be a little tricky sometimes because you can look at programs in a way that, oh, well, you can almost say that that is a policy because it requires a policy decision or a budget decision and things like that. So it can be a confusing area for people to think about.
Yes, and I agree. I think that that's an area that I've seen a lot of groups struggle with because I think the exact same thing can be, the exact same approach can be a policy or it can be a program, and it depends on how it's implemented.
Yeah.
So policies, think about rule change, not necessarily laws, but the rules of a workplace or of a school. And so if you just plant a garden and that's all you do in a school, that's a program because that's something that, you know, it's an activity. If you stop gardening, it goes away. If you write into school policy that all schools are required to have a garden and that the produce from that garden will be used in school lunches, and that school lunches have a certain percentage of fruits and vegetables every day, that becomes a policy. And the garden is part of it and a piece of that, but it's sustainable because if the person who is really excited about putting that garden in place as a program retires, quits, loses their funding, the garden goes away. If it's written into school policy that the school will fund a position or will fund in some way having gardens at every school, it becomes a policy change. So hopefully that helps a little bit. It's a small example, but you know, I think it's one of those things where the exact same thing, it can look the same on the outside because we don't always see those rule changes, but it depends on how it's implemented and written into either written into policy or not.
And how sustainable it is. I tend to, when I'm listening to people give examples, I listen for how much staffing support does it require and how much every year we have to go out and get new money in order to make this continue. Yeah, there's a certain amount of money, but with policy sometimes it becomes so institutionalized. It's the way we do business, and we don't think about it as a specific staffing endeavor.
Yep.
That's a good example, Kate.
Yeah. Sarah, do you have anything that you want to add on that?
No, I would agree, and that's what I was thinking about with while you both were speaking, is I would echo what Jan had said is it's about making sure even if it starts out and it looks like a program, you know, for example, our gardens, it's got to be written in so that, again, this funding is going to be gone in 2 years. How are they going to do it? Well, now it's written into their science program and it's written into their curriculum for, you know, biology because they're going to put worms out there. You have to make sure it becomes a piece that they can't get rid of or that would be very hard. You know, it becomes a piece of their everyday culture or the school doesn't see it as an option anymore. This is just what we do. And it is sustainable. You know, you guys have to do it. You wrote it into your curriculum. Do you know how hard it is to bring back together your curriculum committee? You know, that's what you really have to start looking at things a little bit differently because it's that long-term piece.
It is important to think about, though, the implementation piece of policy. It can be, maybe it's difficult sometimes to get policy put in place and passed, but it's only useful if it's actually implemented and followed up on. So you also have to make sure that your group doesn't just get something passed and put in place and celebrate. I mean, celebrate that absolutely, but don't celebrate and walk away. Make sure that it's implemented, that it's followed, that it's enforced, and keep checking up on that and make sure that those pieces are thought out and put in place as well. That's where policy can become a little more challenging as well as in the implementation and enforcement of it. So don't forget about that part of it when you're doing policy work. And it may not be your group that is on top of that, but make sure that you've thought it through and you know who is responsible for that piece of it.
All right, and we are ready to wrap up for the day. Thank you so much for joining us. Thanks to the support of the Robert Wood Johnson Foundation, we have 3 community coaches. You actually heard from all 3 of us today here in the County Health Rankings and Roadmaps program. Our assistance is available at no cost to you, so please don't hesitate to contact us if you need assistance with this tool or another tool, or you have a question about what your next step might be in your process. We are available to help in any way that makes sense. We are working our way through 3 series of webinars this year. In addition to the Take Action series, we also have a series of webinars focused on breaking down the rankings model and a series focused on partnerships. We regularly send out announcements about upcoming webinars to our e-newsletter subscribers, so if you haven't subscribed to our e-newsletter, now is a great time to do that. You can do that by emailing us at the email address listed here. You can also stay connected with us by following us on Twitter or liking us on Facebook. So thank you again for joining us today, and we look forward to seeing you on future webinars.